Welcome everyone. This video presentation will orientate you to what can be found in this vaccine clinical tool. This tool has been developed in collaboration with stakeholders from the National Department of Health, the South African MRC, and staff from the Sisonke clinical trial. It has been designed with the aim of providing practical support on the ground to those who are going to be involved in the vaccinations. It provides the detail of how to store, handle, prepare, and give the vaccine, and clarifies roles and responsibilities. As with most documents relating to COVID, this is an agile document, meaning it's likely to be updated and adapted as the vaccine rollout proceeds and expands. This document pertains to the initial rollout of the J&J vaccine, known more scientifically as the Ad26.COV2.S COVID-19 vaccine. So what's in this clinical tool? We'll take a brief look today at guidance on how to store and handle the COVID vaccine, how to prepare and draw up the vaccine, the pathway the client or vaccinee will follow, pre-vaccination health check, which also provides additional guidance for the vaccinator on how to further assess the risk of allergy. It continues with guidance on how to administer the COVID vaccine, what advice to give the vaccinee post-vaccination, and towards the end is guidance on how to manage immediate symptoms, including stress-related incidents like a simple faint, as well as more severe reactions like anaphylaxis. Lastly, a page has been included on how to manage common symptoms within a week of vaccination. You will notice colored boxes that help delineate current roles and responsibilities. Pink boxes indicate what clinical research staff are responsible for. Purple boxes indicate what a triage nurse is likely to do. Blue boxes indicate queue marshals. Green boxes indicate admin staff responsibilities. And yellow boxes indicate what a vaccinator will have to do. So starting at the beginning of the process, with storing, handling and preparing the vaccine correctly, you'll notice the pink box indicating that currently this task is for clinical research staff, or at least a designated staff member under the supervision of clinical research staff. Storage, handling, and preparation spans 2 pages and covers 6 steps. How to store the vaccine when it's received, how to thaw the vaccine, and when ready to prepare and draw up the vaccine, how to inspect it, how to prepare it and withdraw it, how to store the filled syringes, and what to do with the used vials. I won't go through this in detail, but rather highlight some of the main take-home messages, like it's important to ensure the vaccine is secure at all times. The vaccine can be stored in the freezer for up to a year. It can be stored in the refrigerator for up to 28 days. Once thawed, it can never be refrozen, and it should not be stored at room temperature. It is thawed overnight and needs to be acclimatized, meaning brought to room temperature when preparing syringes. The vaccine needs to be inspected, the concentration and appearance checked. When preparing to draw up, the vaccine needs to be mixed by swirling, not shaking. The correct volume needs to be drawn up. 2 doses of 0.25 ml each can be drawn from each vial. The correct syringe and needles need to be used, as needles should not be changed prior to vaccination. Expiry times are noted on labels, and relevant records need to be completed before filled syringes are handed over. After the drawing up, the vaccine syringes can be held in the refrigerator for up to 6 hours and at room temperature for up to 2 hours. Vials should not be discarded, rather marked with a black marker to indicate they have been used. A triage nurse or equivalent should screen each client or vaccinee entering, and a symptom screen should be done. If this is negative, a queue marshal, or similar, may direct clients who are in possession of a voucher code to an expedited, meaning quicker, registration queue. Admin staff will then check registration details, and the client will proceed to the socially distanced vaccination waiting area. Should the client screen positive for symptoms, they should not proceed but be referred back to a local practitioner for further assessment, testing, and management. If the client is not correctly registered, the case will be escalated for assistance. The pre-vaccination health check supports the vaccinator. There is a reminder about correct PPE and a statement that the client will have already been screened as per the previous page. It goes on to prompt the vaccinator to work through the necessary steps on the electronic vaccine data system known as the EVDS, like confirming ID and going through the questions that form part of the clinical consent. The vaccinator will need to capture whether consent is given. If it is not, the vaccinator will need to end the visit. If it is given, then the vaccinator will continue to decide whether to proceed with vaccination today by checking the following: if the client is currently taking part in any studies, if the client has had COVID in the past 4 weeks, if the client has received another vaccine in the last 2 weeks, is pregnant, or has an uncontrolled chronic medical condition that is requiring ongoing specialist care. It then prompts the vaccinator to check about bleeding disorders or anticoagulant therapy, as they may need to check for INR results. Finally, the vaccinator will need to ask about allergies. If no history, the vaccinator may proceed to vaccination on page 8. If the client has a history of allergy to a food, a substance, a medicine, or a previous vaccine, the vaccinator will be prompted to further assess the risk of immediate allergy on page 7. Here, the vaccinator will start by explaining what a severe allergic reaction means. Then they will ask about previous severe allergic reactions. If no, the vaccinator may proceed with the usual vaccination, with the usual observation period of 15 minutes. If, however, the client has had a severe allergic reaction in the past, the vaccinator should, based on whether this past reaction was to a previous vaccine or an injectable medication, decide whether to refer to a doctor for further risk assessment, as this may be one of the rare instances where you won't vaccinate a client. If the previous reaction has been to another substance, like food, a pet, insect sting, latex, or an oral medication, then the vaccinator is prompted to proceed, but extend the post-vaccination observation time from the usual 15 minutes to 30 minutes. This page provides guidance on how to give the vaccine, starting with a reminder to check the emergency kit and protocols at the beginning of each session. It then outlines how to prepare, how to give the vaccination, how to dispose of sharps and materials, how to complete the EVDS records, and then how to observe clients post-vaccination. The vaccinator is prompted to select an appropriate length needle based on the patient's weight. Importantly, not to change the needle. Check the expiry, appearance, and volume. The next block provides a step-by-step on how to give the vaccine as an intramuscular injection. Then, how to dispose of sharps and contaminated materials. The client is encouraged to sit for a few moments while the vaccinator completes the EVDS system. This may provide an opportunity to give relevant post-vaccination information, which can be found on page 10. Side effects can be further explained, the potential of getting COVID can be discussed, and the need for ongoing preventive measures should be reinforced. And when the client needs to contact the safety desk should be explained. The observation box outlines what signs and symptoms the vaccinators should be on the lookout for during this period. If the client has no problems, they may leave with their vaccination card and their alert card. In time, the client should also receive an SMS confirmation with a vaccination proof code that can be used to verify vaccination status. If, however, they do develop signs and symptoms, they will need to be further assessed and managed urgently on page 11. This page starts by reiterating how rare anaphylactic reactions are. It assists the vaccinator to distinguish a client who has collapsed because they have fainted from a client who is experiencing an anaphylactic reaction, and provides the management for both of these. It also increases awareness that immediate, non-severe rashes are being seen in clients who remain well with no other symptoms. It also prompts the reporting of these incidences once the client is stable. A page at the end of the clinical tool provides a clinical approach to managing a client with symptoms who returns to a health facility within a week of vaccination. Symptoms may be systemic or local in nature, involving the site of injection. If systemic, the clinician is guided to exclude severe conditions that require urgent referral, and then discern symptoms that may be attributed to reactogenicity versus a possible new COVID infection. A reminder here that the vaccine cannot give one COVID. This is referring to a situation where a client may have caught COVID before being vaccinated, or just after, whilst the immune system is still being trained up to fight COVID. Lastly, an online clinical course has been developed to familiarize vaccinators with this clinical tool, using the usual simulated case scenarios. It is available via this link and can be completed on a phone, a tablet, or a computer. It will take about 2 hours to complete, and it is data-free. Please note that this course doesn't replace national or provincial trainings that vaccinators are required to complete. This course is designed to complement the vaccinator training. This brings us to the end of this orientation to the clinical tool to support the initial rollout of the J&J vaccine. I do hope that it has been helpful. Thank you.